how to address and decrease the fear associated with pain for clients who have no structural or soft tissue damage. So this was my question, and this is a very, this is a rabbit hole kind of question. How about it, Chris?
Yeah, cool. So it's certainly not an easy one, and educating people about pain is a massive part of my job, because people don't understand pain. Okay, clinicians don't fully understand pain. You know, the best medical minds in the world, we still don't fully understand pain because it is so multifactorial and there's so many different things that affect it. And to put it simply, mate, pain's weird, right? And we can make our best educated guesses as to why people are in pain, but they're still at the end of the day going to be educated guesses, right? Because there's still so much we need to learn. But the most powerful thing you can do is educate people about what pain is and how we get pain. You know, we know pain is a production of our central nervous system. It's can be due to either actual tissue damage or potential tissue damage. It's our body's alarm system, and it's multifactorial. There's so many different things that influence pain. It's so heavily influenced by our beliefs, our environments, our past medical history, stress, our mental health, depression, anxiety, our sleep patterns, you know, even the weather. All these sorts of things influence pain, and people don't tend to understand that in society. People just link pain to injury or tissue damage or something being
broken,
loose or tight or broken. Exactly right. Whereas there's so much more involved in it. And it's our job as clinicians and as coaches to be constantly educating people about the multifactorial nature of pain, because what we understand, we fear less. And that is so important. I think, you know, some basic strategies is that you want to be, one, educating them about the things that, you know, like we just said, influence pain. Constantly encouraging people to move, you know, despite pain, talking positively and talking gently and encouraging and reinforcing people that pain does not always equal tissue damage. You know, it is simply your body's perception of threats. And if your body perceives there to be a threat, completely in the absence of tissue damage, then you'll get pain, right? And if your body doesn't perceive there to be a threat, even if there's a hell of a lot of tissue damage, we won't get pain. And people need to understand this, yeah? You know, a good analogy I like to use is, as I think I touched on just a second ago, that pain is our body's alarm system. And that alarm system is extra sensitive. And that's designed to protect us, because if our alarm system was not extra sensitive, then, you know, we'd be walking around hurt and injured and, you know, in a disease state all the time, right? You know, pain can be similar to a smoke alarm going off when you burn the toast, right? Burn the toast sucks. It's not going to taste as good. It's slightly inconvenient, but it's not actually a fire, right? And the vast majority of these cases, like you've mentioned, that these people that have pain where with no structural damage or soft tissue damage or injury, nothing is broken, we need to be able to encourage them and educate them that, hey, nothing's broken. Your body's alarm system is a little bit sensitive at the moment because it's trying to protect us. But if we stay positive, remain active, go about our daily activities and don't let it stress us out, don't let it make us, you know, be fearful of everyday movements, we're going to be okay. All right. And if you can do that, which, as I said, is far easier said than done. Some people are going to be a lot more receptive to this than others. Some people are going to believe you, and some people are going to think you're full of shit, to be perfectly honest. But you can only try your best to do that. And if you can educate people and they understand it better, that's going to decrease their fear around it. And in turn, that's going to decrease their sensitivity of their pain as well and their nervous system, and they're going to feel better. So, yeah, that's my thoughts.
Spot on, man. Spot on. I'll chime in with, you know, what I've seen in practice. Obviously, people get hurt doing big lifts sometimes. Like, there is inherent risk associated with lifting weights, and especially, you know, pushing the boundaries of what's possible physically in terms of strength and muscle growth. So, you know, injuries do happen. And what I've seen with people who get hurt on a specific movement is that their fear or perception of that movement causing pain or being linked to pain is increased. And just by fearing it, they're going to experience more pain than what they otherwise would, as Chris was saying then. And what I found to be really useful is to, like Chris mentioned, educating them so that they understand pain and, you know, that there is not going to be any damage caused by, you know, performing the movement, provided technique's good, loads and volumes are managed, etc. But also exposing them more frequently to that movement. I think, you know, we could use being fearful of heights as an example. You know, with any sort of fear, often exposure therapy is a really good way to minimize and reduce fear. So with this kind of, you know, issue, when you've got the all clear from a, you know, registered physical therapist, practitioner, you know, healthcare provider, that there's nothing wrong with the client, and that they're still feeling pain when they do a certain movement, you know, exposing them to it more regularly with obviously lighter loads, lower volumes, and more technique work. I think it's really important when you're reintroducing a movement that somebody feels pain with, to start by mobilizing the joints, number one, so they can actually get into positions, because this is where we see most people getting hurt because they don't have adequate mobility, and to also make sure that we're improving tissue integrity, so blood flow, like slowly getting the tissues working, as opposed to loading up the joints, deactivating overactive muscles. For example, in the deadlift, people are going to get pain when they pull with their erectors. So making sure that their glutes are activated, their anterior cores are switched on, and that the erectors aren't doing too much work is a good idea. And then slowly increasing range. I think that's been something that I didn't do in the past, but I'm much more aware of now, is that people can get into a position, but having strength and control of a certain position is a different thing. And if somebody doesn't have the strength through a full range of motion, and there's a little bit of a deficit in their control or strength, there's going to be compensatory movement. This is where they get pain. So the simple act of reducing range of motion and then building up strength through that range as stability increases has been really useful in that exposure therapy phase, where we're trying to reintroduce a movement and get somebody back to full strength in an exercise and be performing pain-free. So I guess that's just my little spiel on what I do in a practical sense on the gym floor, with no real qualifications, just by learning from Chris, over the years. And if there's anything that you want to add to that, Chris, go for it. Yeah,
I think, the other thing you can do is actually push your clients to some external resources, which can really help. And a couple of things that I'll mention, there's a YouTube clip that's called Understanding Pain in 5 Minutes. And literally it's a great, really
the description.
Simple, easy to understand 5-minute YouTube video that helps people understand pain. And it's really, really effective. You can say, okay, spend 5 minutes tonight after a consult watching this. It's going to reinforce the education you give to clients. Okay. Either for your clients or even for just your ongoing learners, your coach. There's a really famous book called Explain Pain, which has been written by guys called David Butler and Lorimer Moseley, who were two of the pioneers in pain research and education in the physio world, and that's a fantastic resource. That's Explain Pain. And there's another resource that I've come across just in recent months, actually. It's called Sticks and Stones, which was written by an American clinician, I believe, by the name of Jared Hall, which has basically a hell of a lot of anecdotes and simple ways to actually understand pain. And like you said before, decrease the fear involved in pain, because it helps people understand it better, and they can say, okay, that's exactly what it means, and this is what's going on, and okay, cool, it can take the fear away, and then they can go about their, exposing them to those previously painful exercises like you spoke about with your client on the gym floor. So those 3 resources, I'd certainly recommend, either for your own learning or to pass on to your clients. Understanding Pain in 5 Minutes, Explain Pain, as well as Sticks and Stones. They're really, really useful.
Awesome. And just one thing I'll add is I actually get my clients to rate their subjective pain on a scale of 0 to 10 for a given exercise each set. So if we see the pain ascending across sets, or it starts to climb too quickly after a certain volume, we know that we've done a little bit too much volume and we should probably pull back. Same for intensity. So if we're adding weight to the bar week to week and we see pain climbing across the week, we know we've probably overshot what structurally they're capable of, without getting any form of discomfort, which leads to pain, all the rest of it. So I think using those measures, but also only using them if your client is educated about pain, and making sure that goes hand in hand. Because if you're using these kind of subjective measures and you've got a client who doesn't fully understand, pain and the process that you're trying to take them through, they're just going to rate everything as a 10. Everything hurts. I don't want to do it. It hurts. When in reality, that might not be the case, nor beneficial for their long-term development. So I think getting feedback from the clients, as you go, is really important in determining whether or not you add weight, add reps, add sets, and so on and so forth.
Yeah, absolutely. And just to add to that, with one last point, I think, something that I use as well with a lot of my clients in terms of their rehab is similar to what you just talked about. Keeping their exercises within an acceptable level of pain, okay? Using a 0 to 10 scale is quite handy, and I generally say, as a rule of thumb, if you can keep an exercise at or below a 3 or 4 out of 10, and you're making sure that's not getting worse or building up throughout their sets, and you're making sure they're not getting a lingering ache, in the 24 to 48 hours afterwards, then that's okay, okay? there's actually research out there to show that particularly with people who have had chronic pain and persistent pain, that exercising into pain can actually be more beneficial than, being scared of that and not moving into pain at all. So that's something that I use all the time. I talk about that acceptable level of pain. But once again, it completely depends on the person, and you don't want to use that on the client that comes in with a completely straight face and in no signs of agony, but says they're in a 9 out of 10 pain. Well, you're probably not. Or the client who's wincing in pain. Says, oh my god, yeah, it's probably a 1. You've got to sort of adjust that accordingly, and these scales are very subjective. But using something along those lines can certainly be quite effective